It is quite like maybe could you please mention another type of the treatment instead of acupuncture, Tai Chi movement, and also herbal medicine that you study?
Yeah,
massage tuina, you mentioned.
That's right. In old days, we translate this word into English. That was massage. But massage and tuina therapy is different. It's quite different.
Okay.
Yeah, tuina is something like acupuncture. Maybe when we see, I know that in Germany we also have another therapy by hand, that is acupressure.
Yeah,
acupressure. Acupressure. Acupressure is something like tuina. It's just similar. It's not the same. Actually, it has big difference. Tuina is also based on meridian and acupuncture points. Yeah. So tuina is just different from acupuncture. Acupuncture is use needle, but tuina is use your finger.
Yeah, finger and needle, the difference. Yeah.
That's right. But the deep principle was the same.
Okay.
Was the same. So tuina is also another treatment method. It has the same position with acupuncture, herbal medicine, and exercise. Just like we talk Tai Chi.
Okay.
Yeah.
Maybe with tuina, because you use the hand, for example, it is less invasive to the body. Yeah. Because needle you need to be pushed inside the body. Okay.
Yeah.
Now I learned more about about this one. Thank you, like. Wait, we can edit this part. I remember when you talk, but now I forget. Yeah, like when you study traditional Chinese medicine, as far as I know, in German society particularly, they didn't see you as a real medical doctor. But for me, you are, I think, because you also do diagnostic, and maybe one because they didn't know what did you study. I'm sure you also studied what is it called, anatomy and physiology, right?
That's right. That's right.
Okay.
Yeah, that is what I mentioned just now in the second part for the Western medicine. Because you know, in university, time is limit. If you learn this, you won't have enough time to learn that.
Yeah.
Okay. So I must say that our clinical medicine knowledge is not so deep as Western medicine doctor, Western medicine university students. But we also learn near all the subjects they learned. And when we before we go to clinic, we must have also another 1 year to practice
in Western clinic, medicine clinic.
That's right.
Okay.
That's right. That is why after my graduation, I was working in a Western medicine university clinic.
Okay.
Yeah. That is right. You said in Germany, Chinese medicine doctor is not recognized as a clinic doctor. Yeah. This has some historical reason.
Okay.
That is very interesting. You know, in Germany, if a doctor wants to work as a doctor in Germany, the Asakama in Germany must recognize this certificate. Okay. This doctor. Before this certification, they must match the education experiences between Germany and the target country. I have these experiences that I apply for my doctor lessons in Germany, but Astakama gave me a replay. That is what I have been educated in China. My program cannot match any of German system, medical education system.
Cannot match any?
Cannot match, because they don't have even one university to teach Western medicine and traditional Chinese medicine combination.
Okay.
That's the reason.
Okay. But I'm sure many of the curriculum or curricula in your university and Germany, maybe many subjects are the same.
That's right. Yeah. That's right. So Asakama can, based on this curriculum, and give you a suggestion that that is because such as you need to learn more on inner medicine, or you need to learn more on surgery, and when you get them, you can try to apply again.
Okay.
Yeah.
So this is one of the solution actually they offer this one.
That's right.
And then so you can do maybe in German it is called hospitation, yeah?
Yeah, hospitation.
Did you try already?
You know, my German is not good. This is the biggest problem in Germany. If you want to work as a doctor, you must have at least a C1.
Yeah.
C1 and medical German.
Yeah, because you know when daily conversation and medical German language very much different.
Yeah.
For me also for daily conversation maybe enough, but for the scientific or higher level will be difficult, especially for medical, because you need sometimes to take care the old person who do not speak so loud, like this. Okay. So you already mentioned about surgery. You also learned surgery when you studied it. Did you also ever perform surgery in China, for example?
Yeah, when I was practicing in hospital before I worked in neurology department and also in emergency.
Okay.
Yeah, I was practicing in emergency for 3 months. 3 months. There I had an opportunity to make operation. Yeah. As an assistant, the first assistant. That was the only experiment. The experiences I did by my hand personally. And after that, when I'm working in Harbin Medical University Hospital 1, I also had hospitation there. And also have half a year in surgery department. All surgery department as neurosurgery and general surgery.
Okay, so you were also exposed to the surgery.
That's right.
But maybe from German perspective, the Ärztekammer, they see it is not enough yet.
That's right. Okay. And another story is that. In Chinese medicine, nowadays we have Chinese medicine surgery.
Okay.
But in old days,
nobody.
Before the Western medicine imported to China, acupuncture was recognized as traditional Chinese medicine surgery.
Okay.
Yeah, and a famous Chinese acupuncture doctor in very old days, or maybe I think it's about 1,000 years ago.
Okay. 1,000 years. Okay.
Named Hua Tuo. He did the first neurosurgery in China.
1,000 years ago, already perform surgery.
Yes, that's right.
Wow, quite long time.
Yeah, if you or any other friends in front of the screen have this interest, you can try to Google Hua Tuo.
Okay, I will write later in this description.
HUATOU.
Hua Tuo.
Yeah.
Okay. Yeah. I will mention in the description. Then you also can search my audience about this one. I also will put the map where Harbin is and his university later on. So everyone will know it about this.
Thank you.
Like after you graduated from this traditional Chinese medicine, you also said you work. Thank you. Okay, like you mentioned that after you finish your study in this traditional Chinese medicine, you work in the hospital only in Western only in Western hospital, or you also work in the traditional Chinese hospital?
No, I worked in a Western medicine hospital. It's the first place in Northeast Asian.
Okay.
It's Harbin Medical University Hospital 1.
Okay.
But I was working in an acupuncture department.
Okay.
Yeah.
So there is an acupuncture department in this one. So you mostly work with the patient by using acupuncture therapy like that.
That's right.
May I ask you what type of patients did you treat mostly at that time?
Yeah, neurology. That is in neurology, especially stroke patients.
Stroke patients.
Yeah, stroke patient.
Okay.
Because just now I mentioned in Jiang University of Traditional Chinese Medicine, they have 2 hospitals.
They also have
2 hospitals. The hospital 2, we call it acupuncture college. Acupuncture college. There, acupuncture and neurology, they are the same department. Yeah, and actually, we were doing what rehabilitation should do. Yeah, after stroke.
Okay.
Yeah.
Not only acupuncture but also the complex rehabilitation treatment.
That's
okay.
right. In an opposite idea, just different from abroad China. They use acupuncture to treat pain, to treat another unbelievable disease. But in China, only neurology and pain is popular.
Okay.
Yeah. Although we also use acupuncture to treat any other different disease.
Okay.
Yeah, but not so ordinary, not so common.
Okay. Yeah. Maybe acupuncture also can be used after surgery, for example. Yeah.
That's right.
Okay.
That's right. Yeah. Yeah, acupuncture can be used for after surgery. To help people get better soon, and can help people to do the basic exercises.
Okay.
Yeah, because we also use electronic acupuncture.
Okay.
That is quite important for muscle to move.
Yeah. Okay. Yeah. For the audience, actually, he already tortured me with acupuncture. Not tortured, actually, treated me. It was very good. I will show maybe the picture later on also when I upload to the YouTube later, because I was acupuncture here.
Yeah, that is because Boya's knee pain
problem.
Yeah. When we mention this, maybe I can tell you more. That is because here, just now Boya mentioned here, this has a big meridian connection with the knee. With the knee. When you have knee painful, we use these acupuncture points, and Boya can present us what he feels.
Yeah. Actually, when I explain, because I had a surgery before in my knee, and then sometimes I had a problem, pain. Yeah, and then I informed Lei, and then he suddenly, okay, let's do acupuncture. I was surprised when he said we should acupuncture here below my eyes. I thought it should be at least near my knee, but he didn't, and then he explained it. But within minutes, I think it reduced my pain very much. So see, actually acupuncture cannot be done or cannot be performed by any people. They should learn first, because to find the good point, the meridian point it is called, is really important, and only someone who already studied it can perform it, not anyone.
That's right, Boya. But acupuncture points is there.
You mean the map of acupuncture?
Yeah. Anyone can find the acupuncture points, and also you can use textbooks, you can use internet, and they have very clear description where the acupuncture point is. But the problem is, aspirin is there, ibuprofen is there. Can you use it?
Which one is the best one? For example,
that's right.
Okay.
When you use it, when you should use it, and what you must pay more attention on. When you should not use it, which points in which disease it is dangerous to use. Yeah, not professional people will never know that.
And also, I also know because he showed me different type of needle, long, short, thick, thin, like this. This also need education. Not only the point also.
That's right. The needles, tools, and the hand, we call it hand skill. The hand skill use also need to be educated.
So See, maybe did you also learn cupping therapy during the traditional Chinese medicine? Because in Indonesia we also have cupping therapy, sometimes with fire.
Yes, you're right, Boya. You're right. This is another very interesting topic. That is, we do cupping. We do cupping, but we didn't learn it. Yeah.
In your university you didn't?
No, I didn't learn it. But but our acupuncture teacher, professor, used to tell us about cupping. I have nothing to teach you. You just need to practice how to put cupping on person's skin. But where to put it, just use your knowledge about acupuncture.
Meridian.
Particular.
Okay.
There's meridian, there's acupuncture points, and there's anatomy, there's anatomy about muscles.
Okay.
Use this knowledge. And I learned cupping just after I have studied in university.
Okay.
When I had my practicing time in hospital, my tutor in hospital taught me about the cupping. That was really easy to learn because you just need to know how to put it on the skin, and you already know where to put it.
Because I also learned it before in Indonesia, but maybe only short time. I think only 2 or 3 days. I forgot. But at the time, my mother told me, please do not do it.
Why?
She was afraid that I will do something incorrectly. Because at the time I learned it in Indonesia, and then directly I moved to Korea. If I do in Korea, maybe nobody watch me how to do it. So she was afraid. That's why I already forgot now how to do it.
Yeah, traditional Chinese medicine is not only has a development in China, but also in most Asian countries. Especially in Korea, Japan.
Okay.
But to be honest, in Japan, the Chinese medicine reception has a very big success. Yes. That could be because of the policy of different area. And many Chinese people always want to buy this medicine from Japan. When they visited there.
Okay.
Interesting, right?
Interesting. Lei, I think because you also need to leave, maybe I think at least for me, I really learned a lot, and I'm sure the audience also learned a lot. But I have maybe another question. You studied 5 years in the university
for bachelor,
and then you need to do practical year also. Okay. And then you get the certificate that you are traditional Chinese medicine doctor.
Yes, this is different at this moment, because Chinese health system is also developing. It's also developing. I was graduated in the year 2006. At that moment, the basic how to say that, the basic doctor training in hospital is not so common. It's not so common. So after bachelor degree graduation, you can work in hospital for 1 year. After that, you can apply the examination for the doctor license.
Okay.
When you pass the doctor license, you can work as a real doctor.
Okay, I see.
But after 5 years, I graduated for a bachelor degree. The health system has big change.
Okay.
People who has graduated from medical university, including TCM Medical University, also and Clinic Medical University. If the people only have bachelor degree, he or she must have another 5 years training.
5 years.
That's right. In hospital.
But it is paid.
Yes, it's paid.
You will get salary.
It's paid, but not too much. After these 5 years, you will be recognized as a real doctor.
Until now, the regulation like that.
That's right. But it also has some policy change. That is, we make some more details. That is, when people have a master degree, this period can decrease to 3 years.
Okay.
Yeah. When people have a doctor degree, this period can decrease to 2 or 1 year.
Okay, I see. So it is almost like in Germany, but in Germany, so after a bachelor degree, they do 5 years training in the hospital, but they will have Facharzt or specialist.
Yeah, specialist. That's
Okay.
right. Yeah.
So it is also the same. It will be specialist or.
I'm sorry to say, you also need to apply it and try to pass the exam to become. We don't call it Facharzt or specialist. It's a little bit middle level.
Oh, okay.
Yeah. And after that, you also need another 5 years to become we can call the specialist.
Okay.
Yeah.
So quite different.
Yeah.
Okay.
That's right.
Sorry, I said it was the last question, but I now came into my mind. I'm sorry.
We can have many questions.
No, okay. Because you know, I'm because in Indonesia, I think traditional Indonesian treatment, for example, are not covered by insurance, at least a government insurance. How about in China?
In China, this is quite different. Traditional Chinese medicine treatment can full covered by health insurance.
Government or also private?
Both. Actually, it's government level. The private insurance. They don't pay for this part because the public insurance has covered already.
Okay, I see.
Yeah.
Because so every Chinese people has government insurance, so they already have this one.
Yes, that's right. That's right. But you know, just like what we know from our last project. Yeah. In China, the health system is a little bit. House insurance system is a little bit complex, and the people was divided into city people and people living in country
and people
countryside. People movement who has residence in Chinese is 户口, who has 户口, who don't have 户口. It's quite different. It's quite different. But also, well, you know, I have been in Germany for about 10 years. China has a very high speed to develop.
Yeah.
So the policy is always improving. So maybe it changed, but I'm not quite clear.
Okay.
Yeah, because we will present it in YouTube. I must take responsibility of my words. Yeah. So I'm not quite sure about at this moment what happened.
Okay.
As I know, as my experiences I was working in hospital in Harbin. I was working in hospital in Shanghai. The person who has insurance come to hospital, they can full cover for the TCM.
TCM.
That's right. And Chinese government also have this policy of TCM therapy is the basic medical care.
Okay.
To all over the world, all over the China, especially in countryside.
Okay.
Yeah.
Very good. Okay, Lane, maybe because already almost 40 minutes, I think I would like to ask you maybe last word. Maybe you can also promote traditional Chinese medicine to people who will watch this one. Do you have any last sentences about this one? Don't worry, I will edit it you.
Yeah, you will edit. Yeah. About this topic, I think as a professional Chinese medicine doctor, I suggest my friends, Boya's friends, and
all the audience.
Who is watching this video, try to find some professional Chinese staff around you, not a person who has interest and learned it by itself to make this therapy. You will get quite different results.
Okay. Yeah. So we should try, and if we want to try or learn, we need to find a good person who already educated in this field. Not only they have interest and they only read without have license to do this.
That's
so
right.
Better with the licensed person.
That's right.
Lei, so I really appreciate your time. and your knowledge that you share with us here in my YouTube. I hope many people will learn, at least for me, but I'm sure the audience also. So again, thank you very much, Slay. Have a nice day.
Have a nice day.
Bye-bye.
Bye-bye.